Hey, we're here at Pikes Flat in the Victorian High Country. It is Friday afternoon. It is the first day of Hut to Hut in 2021, and we're going to do a walk around the EMS med tent setup that we've got here for this event and that we typically run for each event. So we're just going to have a quick walk around the tent, and I'm going to get you to quickly explain the basic setup as we go here, and then we'll sit down and go through some of the packs.
Cool. So yeah, critically we're a satellite base, so we are one of the aid stations around the 100k course. Well, in this year's event it's a 53k course, so we are sort of on the furthest end away from the main med base, which is up at Mount Buller. So up at Mount Buller we've got good road access where we can get some emergency vehicles in if we need to evacuate any participants. We've got obviously like a good telecommunication system up there, which we can get air helicopters if we need. But down where we are on Pikes Flat, we've pretty much got no communication except for our handheld car and mobile radios, which is on the UHF, and we've also got satellite phones. So we're pretty remote, but we can access our med base and they relay out. Okay, so just by way of orientation, the event on the typical race day comes down through here. This is the aid station where they can get food. The med hut is just over here, so we can keep a good watch on them as they're coming down the hill and just give it a check out to see if anyone's limping or showing any typical signs. And then they'll exit out over the river crossing here, and this is one of 14 river crossings that they go through on each day of the Hut to Hut event this year. Yeah, okay, so we'll just do a bit of a walk through the medical tent that is our sort of our remote tertiary hospital that we've got set up here. It's very basic, but hopefully critically we've got what we need to manage circumstances that come up when we need it out at a distance. And our job is to do first aid management, stabilisation of patients, and organise appropriate transport out. And a lot of that's to do with triage and working out the urgency of the situation. So we're anticipating that we're going to have, I think we had 160 runners through today, around about, and then that will probably double tomorrow in terms of numbers. So we're all done for today, which is why we're doing some content. But let's go for a tour of the tent. Here we've got a little bit of sitting area for the medics, for a bit of resting. Plus when we bring our patients in, usually they're sitting down on the bench. If it's anything ambulatory that we need to manage, like sprained ankles, blisters, wound care, foot protection for blisters and things like that, that all gets done sort of here. We have a stretcher at the front, and we also use the vehicles if we need to go out on course that's got a road access to get to anyone. Otherwise, EMS is one of the great companies that does this. We've got a lot of hike medics that we will go out on foot as well. So all of the medics that are here, we've got packs that contain sort of first aid kits and diagnostic equipment that you can head out on track, assess somebody to see the stability and what the actual problem is, radio back, and we've got an ability to understand what problem is we're dealing with. So we really are a mobile team. We get out on course as much as we can. So into our little hospital unit here, we've got things split into kind of the areas that will need them. So if you think back to your algorithm, doctors A, B, C, D, we need to have... We brought what we needed from Medbase yesterday out to Pikes. We really are a remote satellite setup, so we have the basics and that's it. We have anything from airway, breathing, circulation. We need to think about a deadly bleed in the environment. If someone's hemorrhaging out, we need to be able to stop the bleed very quickly. And also we need to think about having defibrillation equipment. And critically in the outdoors, you think about an E as well. An E is for the environment. So we need to have equipment that we can manage hypothermia and hyperthermia, and also to make people able to withstand conditions while we're treating them for their other conditions. So we actually have a lot of equipment to manage the environment as well, which is critically important, and we'll go through everything in detail in a minute. Okay, so A is for airway. So I've opened the box of things that I hope I never have to open. But when we think about airway, we think about sort of stabilising someone before they lose their airway. So we've got adjuncts, so you might have heard of oropharyngeal airways and nasopharyngeal airways. We've also got LMA, hopefully we don't need to use that, but we've got one, and we've got a bag valve mask if we need it as well. We've also got a needle for, you know, a decompression thoracostomy. If you have someone who's got a tension pneumothorax and you need to let some air out of their chest, that's a medical emergency that we'd need to do here if that happened. And we've also got stuff to do a trachea. Let's hope we don't have to use that, but we do have it if we need it. Right, so I've started dissecting the kit, pulling everything out, because you are actually thinking about diagnostics on a person straight away. So you've got airway. Once that, you know, that's there, you actually want to know what their obs are doing, and if they are breathing normally, then you're going to put a SATS probe on their finger, work out what their heart rate is, what their oxygen saturations are, and then you can sort of make an idea about how stable the person is, and also by looking at how they look sort of in a clinical sense. So we've got a diagnostic kit here, which involves a stethoscope for breathing. You want to listen to their breathing. If you've got any signs of asthma, then we're going to be thinking about using some of our asthma medications if they've got a wheeze. Otherwise, breathing also comes down to some of the things that you might think about. If you're hearing someone's got a pneumothorax, then you're obviously going to be treating that so straight away as well. So breathing comes after the airway, but thinking about your diagnostics and your overall picture of how the patient's going. C is for circulation, and so from that we're thinking about sort of blood volume. If a person has sweated a lot, they've lost a lot of fluid, or they've had a bleed and their blood pressure's low, they can't tolerate fluids, we can cannulate out here. So we have a cannulation set. We have two, so I can take one out if I'm going out on the track. Has been done before, but we try not to do it in the wild if we can avoid it. We've got some fluids and a giving set as well if we need to give someone a quick bolus of saline, which we can do out here as well. We've also got things to control bleeding if someone's bleeding, so we've got tourniquets in our trauma kit and the pelvic binder, because if you have a big pelvic fracture, you can lose quite a lot of blood quite quickly, so if we can apply some mechanism to stop bleeding, we'll do that. So it's summer in Australia, so that means there will be snakes around, and Australia, we have I think 9 out of the 10 world's most deadliest snakes. Brown snakes and tiger snakes are what we mostly see around here. It's mandatory that every runner brings a snake bandage with them and knows how to use it, and hopefully they can call for nearby runners if they got in trouble to use their snake bandage as well. We have a lot here, and that classifies as a category 1 or a top triage category for extracting someone. So pressure immobilisation bandages at the scene. Try and minimise any walking or movement that the patient's going to do, or the person. Normally people get bitten on their legs, and we get them up usually by road to the nearest facility for some bloods and seeing if they need any anti-venom at that spot. We don't have any anti-venom out here, so we need to get them out as quickly as possible. So snake bandages, we've got at least one in each kit, plus a couple in various kits in the tent as well, and we hope that every runner's got one on them. So the other D, of course, crucially, is defibrillate. So hopefully everyone's done their first aid and they know when to put the pads on if someone's not breathing properly after they've done CPR. Get the defibrillator on the person as soon as possible. So look, we've got one here at our med base, our satellite med station. The 4-wheel drive club over there, who are our volunteers who do all the cooking, they always carry one with them too. So that's reassuring for us to know that we've actually got 2 on site here. Plus, of course, there's decent defibrillators up at Mount Buller as well, and we've got 1 in the roving vehicle. So we're well set. So for E, in the outdoors, it's about managing your environment. So you can lose a lot of heat to the ground if you get stuck and you're sitting on the ground while you're waiting for help. So we've got quite a few foam mats and on the ground here and here. So if someone was stuck on the ground, put something under them so they don't lose the heat to the ground. Then we've also got various wraps that you would put around someone. So it's mandatory that everyone carries an emergency space blanket, so the foil kind of ones. This can save your life if you get stuck in the outdoors, that you put one of these around you. Or if you're waiting for a helicopter, it's a very good sail that can identify where you are. We also have these little bivvies, which are like foil in a little sack, which are excellent. So we have one of these in all of our hike and run kits. And of course, at our base here, we've got stretchers that we can keep people off the ground. We've got sleeping bags, blankets. We've got a bear hugger with a generator that we've got at the site. and of course some emergency survival shelters, so we can actually manage to keep someone warm here for some time. We've got jet boil stoves that we can heat up water if we're going to make a hot water bottle to put it inside the sleeping bag with the person to keep them warm. Not a problem today, but things can cool down quite quickly overnight, even in the middle of summer.
So obviously one of the things that's really critical when you're out is communications. And you can see we've got quite a decent amount of work done here to try and help set us up for communications. We've got the guys from Sierra at this event helping us out. We've got Lucas here, say hi.
Nice to meet you.
And we try and make sure that we keep really good open communication and record of everything that happens, because obviously there's quite a lot that does happen out on the course that affects potentially the next station. So we see someone who comes in, they might have a low-grade injury, we might give them some kind of medication, maybe some pain medication to deal with that. If that doesn't get recorded, we just got interrupted by Roving Jared, which is our roving medic who follows the course around. But as I was saying, if we prescribe something here to a patient and that doesn't get declared at the next aid station, then there's obviously a risk that within the event somebody could take more than they're allowed to take in a particular type of medication or a particular type of treatment. So communication, keeping really good records is a really critical part of what we're doing here.
So that's all the sort of critical things, but the common things that we're doing is a lot of blisters. So as I think you've already mentioned, the 14 river crossings on this course, but we are doing quite a lot of sort of maintenance of people's feet, or they do it themselves, but they often need our equipment. So we've got various kinds of tapes. Fiximals are really, or Hyperfix is very, very good for blisters. We've got blister blocks. We can clean things with antiseptic lotions. We've got lots of different types of strapping tape that we can make sure people have good protection, so you minimise friction when they're leaving the site here. This site, we've actually got our COVID masks. We've got everything that we need to be COVID safe at this facility. Lots of hand sanitizer everywhere you look, and of course we're outside and we're maintaining our distancing, so that's hopefully going to keep us in good stead for this event. We're very lucky to be out here.
So Doc, I've got a question for you. Why is there a difference between men and women when it comes to friction creams?
It comes down to the scent and the ambiance, I think. Thanks to Premax for being our official supplier of all things anti-friction cream.
And obviously there's a couple of critical bits that the doc's missed here. We can't survive very long without coffee and snacks. So AeroPress and obviously cheese and biscuits are pretty important. And this is the camping setup for the medical team.
Gaiters for snake protection. Always thinking about snakes.